Dr. Paul Abuola has called on the federal government to expedite action on the implementation of the Mental Health Act passed into law 2 years ago under the government of President Muhammadu Buhari. Good day, listeners. Welcome to DDM Health News Update today on our program, Your Health, Your Wealth. I often remind you guys to subscribe to our YouTube channel, that is Diaspora Digital Media, to get the latest on health. So what do you have today? Senior gastroenterologists have warned that untreated and poorly treated stomach ulcers could deteriorate into stomach cancers. They explain that ulcers are caused by a difficult-to-treat bacterium called Helicobacter pylori, also known as H. pylori, and hides in the mucous lining of the stomach, which, if left untreated, could produce cells that could develop into cancer. The GI specialists, as they are also called, urge persons diagnosed with stomach ulcers to ensure they underwent treatment in a medical facility instead of herbal remedies and regime recommended on social media. So please, the hospital matters. In several interviews on social media, the experts further corrected the notion that ulcers were caused by consuming spicy foods, intermittent fast and fizzy drinks, asserting that the presence of H. pylori in the stomach lining was responsible. According to the National Cancer Institute, stomach cancer starts in the cells lining the stomach and could spread to the other parts. Cancer or cancel leads infection with H. pylori, chronic gastritis, alcohol consumption, high smoked and salted foods, tobacco smoking, and familial history, among others, as factors that could increase the risk of stomach cancer. You can see the few things I just mentioned. So please, if you're a victim of all this, take note. Salted foods, high smoke, tobacco smoking, and other alcohol consumptions. So please, your family history also determines. Is that right? Commenting on the matter, a gastrointestinal physiologist called Professor Agona Obembe stated that untreated stomach ulcers can deteriorate into stomach cancer if not properly diagnosed and managed in a hospital setting. She said, H. pylori is a very difficult bacterium to treat. It hides in the mucous lining of the stomach where acid cannot be reached. Oh my goodness. If not eliminated, it continues to damage the stomach wall, producing cells that can eventually develop into cancer. So please, try and do your checkup. They don't further say that in severe cases, untreated ulcers could lead to internal bleeding, perforation of the stomach wall, or stomach cancer that sometimes requires surgical removal of a part or all of the stomach. I'm sure you don't want to be a victim whereby all your stomach are being removed, because I have seen some patients whose stomachs had been removed because the ulcers had degenerated into cancer. Others bleed out due to cancer complications. Yes. The GI expert said, that is Obembe, explained that why spicy foods are often blamed for ulcers. It was caused by Helicobacter pylori, a bacterium transmitted primarily through poor hygiene practices. According to the expert, the bacteria produce an enzyme called urease, which converts urea into ammonia, neutralizing stomach acid and creating a protective environment for the bacteria to thrive. The GI specialist further noted that other contributing factors, such as prolonged fasting, excessive alcohol intake, chronic stress, and the misuse of anti-inflammatory drugs, can worsen ulcer symptoms, but are not primary causes. They're not the primary causes. Yes, because stress stimulates the release of acetylcholine, which in turn prompts acid production into the stomach. When you combine that with the presence of H. pylori and poor dietary habits, you are looking at a recipe for serious damage. Yes. Also speaking, they don't caution against relying on unproven herbal mixtures or social media cures, such as soaking unripe pawpaw in water or blending cabbage and peppers as treatment. Very funny. Ulcers are a serious medical condition. Don't take it for a joke. Grinding leaves and adding pepper will only make things worse. If you suspect an ulcer, go to the hospital. Do the right test. Get the right treatment so that you will be treated. Also speaking, Obembe emphasized the importance of proper hygiene, especially after using the toilet, managing stress, eating balanced meals regularly, and avoiding self-medication with over-the-counter painkillers. Yes, painkiller can also cause ulcer. She also urged patients who have been diagnosed with ulcers to adhere strictly to prescribed treatments, which typically involves a combination of antibiotics and acid suppressants. There is a specific treatment regime known as triple therapy for H. pylori. It must be followed as incomplete or incorrect treatment leads to recurrence, resistance, and complications. If left untreated, they can evolve into life-threatening diseases. Early diagnosis and proper treatment are key to avoiding serious consequences like stomach ulcer. So please, if you're diagnosed with ulcer, try to meet the specialist. Well, also, a consultant gastroenterologist, Dr. Muyiwa Bonjuwoye, stated that if stomach ulcers were left untreated, this could progress and lead to serious complications, including ulcer, because we are lamenting on this word ulcer. Ulcer is cancer rather. Cancer is a very, very bad ailment. It's not something someone needs to have. So please, the earlier, the better. Furthermore, he said that Helicobacter pylori is a very common infection, affecting about half of the world's population. Yes, 99% of Nigerians today has ulcer. Why not everyone who has the bacteria will develop an ulcer? Its presence significantly increases the risk. The bacteria hide in the stomach's mucous lining and weaken its protective barrier, making it easier for stomach acid to cause wounds or ulcer. The gastroenterologist noted that although many Nigerians self-diagnose stomach pain as an ulcer, proper diagnosis is essential, as not all upper abdominal pain is related to ulcer disease. Yeah, because if you have a little stomach pain, next thing you say, do you have ulcer? No, not all upper abdominal pains are ulcer. So please try to go for a checkup. Highlighting the dangers of ignoring treatments, Bonjuwoye said, if left on treatment, ulcer can cause chronic inflammation in the stomach lining, and over time, this persistent inflammation can increase the risk of stomach cancer, particularly if the ulcer is caused by Helicobacter pylori. He stressed that peptic ulcer disease is preventable and curable, especially when detected early. Make that point. Not just that it's preventable, but when detected early. So the earlier, the better. Yes. Thanks to medical breakthroughs, we now treat ulcers using a triple therapy that includes 2 antibiotics and a medication to reduce stomach acid. This approach targets both the infection and the acid that damages the stomach lining. According to the professor, proper hygiene practices can help prevent H. pylori infection, as the bacteria are commonly transmitted through contaminated food or water. He added that the infection is usually acquired in childhood and can even persist into adulthood if not untreated. So please try to treat it if you're diagnosed of such. He urged individuals with a family history of ulcers or those experiencing persistent symptoms to undergo screening, as early detection is key to effective treatment and prevention of complications like bleeding, perforation, and cancer. Bonjour encouraged Nigerians to avoid self-medication, especially with painkillers, and to seek proper medical advice when experiencing symptoms such as persistent stomach pain, bloating, or nausea. So please, don't forget to go for check-up. Next, experts have decried the growing shortage of practical facilities across many universities, saying the development is impacting the quality of training for medical laboratory science students in Nigeria. The experts worry that medical laboratory science, a field that relies heavily on practical skills, is being taught in overcrowded classrooms without sufficient access to essential equipment and laboratory space. Oh my goodness, I can imagine. They further warn that unless universities reduce admission numbers and invest in laboratory infrastructure, the competence of future medical lab scientists could be severely compromised. Wow. The chairman, Board of Fellows, Associated of Medical Laboratory Scientists of Nigeria, Bona Lemadin, also spoke at a recent scientific conference, lamented that the unchecked admission of students into the program was compromising the standard of training and professional readiness of graduates. According to him, many universities now admit hundreds of students per academic section, despite lacking the facilities to offer them hands-on training. You can imagine, how would they learn? Ha! There are several universities offering medical laboratory science as a course, and we have noticed over the years that the universities are over-admitting. He said, for instance, when I was a student, we were only 18 in class. But today, I have seen universities admitting as many as 800 students in one particular year, and there is no way those students can be trained well. So it's a big challenge. Oh my goodness, 800. Ha. He stressed that medical laboratory science is a practical discipline and should not be treated like a theoretical course. You have to be hands-on. Yeah. You actually have to sit down on the bench and use the instrument to work. So when the number of students far outweighs the available facilities, it becomes a problem. Lemadin also urged practitioners to embrace conscious professional development in order to stay abreast of evolving global best practices. The profession is evolving. What we knew years back is not what is on the ground today. So, there is a need for scientists to keep upgrading their knowledge by attending refresher courses and so on. He's lamented. He also called for regulatory reforms to limit admissions into medical laboratory science programs to match available facilities and ensure quality training. Yeah. On his part, a licensed medical laboratory scientist, Akujobi Igwe, lamented the state of practical training of MLS students in Nigeria, that is medical lab scientist students. Igwe, who is also an expert medical parasitologist and entomologist, detailed how inadequate hands-on exposure during undergraduate training is leaving graduates ill-prepared for the demands of modern healthcare laboratories. Yeah, I can imagine, because most students don't even know what they are doing. Practically speaking, a good number of MLS students and graduates in Nigeria are not adequately exposed to real hands-on experience with proper and up-to-date practical facilities during their undergraduate years. Yeah. Also speaking, Igwe pointed out that the many training institutions suffer from inadequate teaching laboratory infrastructure. So how do you think the students can be active? Basic practicals may be conducted, but advanced diagnostic techniques like molecular diagnostics, automation, immunohistochemistry, or real-time PCR are often unavailable or are only demonstrated theoretically. So you can imagine that. According to Igwe, several factors are contributing to the problems. Yeah, I agree with him. We have the pervasive issues of obsolete or limited equipment in teaching labs. So how will students learn? Where equipment exists, it is often outdated or non-functional. Students may observe rather than operate key instruments, which limits skill acquisition. So whereby they just observe, they cannot practicalize. How would they learn? Also, overcrowded practical sections mean many students only watch or share a limited time on the equipment, which prevents individual mastery of procedures. Yeah. Whereby the students are overcrowded. The lecturer might even like maybe today this set, another day this set, in order for them to just have little experience of it. Also, some training institutes are not aligned with the current realities of private and tertiary medical laboratories. It is worrisome, unfortunate, and sad. You can imagine. As such, students may never interact with equipment like automated analyzers, Genie experts, or ELISA readers until their internship. Ha! Lastly, many skills expected to have been mastered during undergraduate training are deferred to the one-year internship, placing a heavier burden on internship centers to complete basic training. Oh my goodness. You can imagine. No wonder some of the students, if they should come to the internship center, they'll be like, oh my goodness, is this how this work? Whereby in the school, that those kind of equipment exist, but they can't practicalize it. They can't utilize it. So another major concern was the disconnect between training institutions and industry practices. Yes, there is also a lack of or inadequate structured collaboration between schools and advanced diagnostic labs, mostly the private sector, that could offer students meaningful lab attachment or mentorship during the training. On the standard of training for MLS graduates in Nigeria, Igwe lamented, in honesty, on average, the standard of training for MLS graduates in Nigeria does not consistently meet the level of professional readiness and requirements expected in today's healthcare and diagnostic environments. What a pity. Ha! He noted that there was a need for a radical overhaul of the current training model, improving modern equipment, stronger industry collaborations, and a curriculum that balances theory and practice in Nigeria. Please, all these things are essential. Medical laboratory is all about practice. If practical equipment are not available, how will they learn? How will they utilize them? What are they learning in fact? If they're overcrowded, how will they learn? These are the things we have to think about. Yes. So please, the government should take note. And also, the universities and institutions should also take note of that. Next, the provost and medical director of Neuropsychiatric Hospital, Abeokuta, Ogun State, Dr. Paul Abuola, has called on the federal government to expedite action on the implementation of the Mental Health Act passed into law 2 years ago under the government of President Muhammadu Buhari. He said that the country could not continue to pride itself as the giant of Africa, without following the footsteps of countries like Togo, Ghana, and the Republic of Benin that have revolutionized medical care for mental health patients in their countries by implementing the Mental Health Act. The provost said that bureaucratic bottlenecks remain a major obstacle to implementing the Mental Health Act and called on the federal government to address the issue, warning that the country is losing significantly by failing to enforce the law. The Neuropsychiatric Hospital MD made this call on Sunday while speaking with journalists at the end of the second annual colloquium on mental health and law, organized by the Coalition of Mental Health and Law Interest Group, with the theme From Mental Health Legislation to Action. Time is now. The provost explained that the colloquium was to serve as a wake-up call and to plead with the government at all levels to support the implementation of the Mental Health Act so the patients could access the best care. He said, the mental health law was passed into law in 2023 under President Muhammadu Buhari, but its implementation is being stalled by bureaucracy. How? The colloquium is to serve as a wake-up call for the Ministry of Health to wake up and do the needful. Yes, the laws protect the mentally ill people. It protects the carer too. Yes. Countries like Togo, Ghana, and Benin Republic are already implementing this law. But we who pride ourselves as giants of Africa can't implement our laws that have been passed for 2 years now. You can imagine. The Act spells out the role to be played by the local, state, and federal governments regarding care for the mentally ill people in the country. Please, we don't want our people to continue going mentally ill. It also talks about funding and some other things that will help provide the best care for the people suffering from mental ill health issues. For instance, in Ghana, we have drugs being given to mentally ill people, but in Nigeria, even the rich people cannot buy them. We are losing a lot. The productive group are held down by mental illness, and these are cases that are treatable if presented early in life. So, a sick workforce is a sick economy. Yes, have that in mind. I repeat, a sick workforce is a sick economy. Depression is the leading cause of disability all over the world. Yes, because when you are depressed, you have no will to work. When you are depressed, you can begin to talk of suicide. It affects your well-being. You may even think it is physical illness, but it's a psychiatric, and you have to spend so much, and you may have spent so much money trying to investigate or diagnose the cause of the sickness, not knowing that it's depression. So, the colloquium is a wake-up call. It is the time the federal government, local government, and state government to arise to take care of the people with mental health challenges. Always remember, depression is a mental health challenge, and if not taken care of, can lead to suicidal thoughts. So please, take care of your health, and the government to also come in to help all these people having mental illness. Well, with this, we come to the end of our program on your health, your wealth. Please don't forget to click on the like button, share, comment, and subscribe to our YouTube channel. That is Diaspora Digital Media, also known as DDN. Until next time I come your way, I remain Nenyor Michael Inizini. Do have a wonderful day. Thanks for watching. Bye for now.